very good morning to all of you. This is my seventh video in which I'm going to tell you about the typhoid. Typhoid that is very commonly caused in this season. This is the rainy season. So I'm getting the I'm getting an idea from this rainy season that there is many contaminated diseases that caused by many bacteria. So one of so many in many diseases there is one of the most dangerous disease that is contaminated very easily in the human body, that is typhoid, and it is caused by the bacterium that is Salmonella typhi, and it is spread through the contaminated food or water by the poor sanitation and contact with the feces of an infected person or the carrier. Common symptoms included that is the prolonged high fever, headache, weakness and abdominal pain. How we save our infant in rainy season from typhoid? अगर टाइफॉइड हो जाता है तो हमें इस मतलब बारिश के मौसम में बच्चों को किस तरीके से हम बचा सकते हैं? Yes, during the rainy season, infant need the extra protection from typhoid and other infections, mainly caused by the contaminated water or the contaminated food, and many contaminated food or the open food which spreads germs. How we protect our infant? हम अपने इन्फेंट को कैसे बचा सकते हैं? हम अपने बच्चे को किस तरीके से टाइफॉइड से बचा सकते हैं? इट इज ब्रेस्ट फीडिंग रेगुलरली. इफ द मदर इज normal and the baby get caused by the bacterium that is Salmonella typhi, and that causes the disease called typhoid, then the mother is taking the step to feed very properly. After that, for the young infant, and exclusive with breastfeeding is recommended for the first to 6 months. After that, use safe water. Safe water is very important because the typhoid is generally caused by the contaminated water in the food. So giving only proper treatment, treated safe water when the water needed according to the baby age and feeding plan. Wash hands before touching or feeding the baby. After using the toilet or changing the diapers, they are used to wash their hand or sanitize your hands. Next, keep feeding bottles, utensils and breast pumping equipments clean. If जब कभी भी आपको अपने बच्चे को फीड करना है या कभी भी बच्चे को दूध पिलाना है या बॉटल जो भी जिस बॉटल से वो निप्पल से दूध पीता है तो उसके निप्पल को और उसकी बॉटल को बिल्कुल गुनगुने पानी में यानी कि ल्यूकवार्म वाटर के साथ उसको धोना है, उसको सैनिटाइज करना है, उसको क्लीन करना है, एंड आफ्टर दैट वी आर गोइंग टू यूज. नेक्स्ट, अवॉइड अनयूज्ड आउटसाइड और अनकवर्ड फूड वाटर फॉर द बेबी, यानी कि बच्चे के लिए कोई भी बाहर का अनकवर्ड फूड या वाटर सेफ नहीं है ड्यूरिंग टाइफॉइड और ड्यूरिंग द रेनी सीजन. कीप द बेबी सराउंडेड बाय द क्लीन एंड ड्राई, स्पेशली ड्यूरिंग द फ्लडिंग और वाटर लॉगिंग. Ask your pediatrician about the typhoid vaccine. If your baby is get infected by the typhoid without taking any steps for prevention, then what we have to do, we are going for the pediatrician, then ask for the vaccination. So what are the vaccination? That depends on your child's age. What your child's age? If the child is in the prenatal age, there is no infection, there is no injection, there is many tests that is given by the pediatrician, or what the pediatrician recommended, that must be followed by the parents. Okay. Next, if the infant is infected by the typhoid, then what the mothers do? If the infant get infected by the typhoid, then mothers started contact with the pediatrician promptly and follow the prescribed treatment exactly what I am saying in earlier. Okay, continuous breastfeeding frequently and unless the doctor advise otherwise. Okay, that means the continuous breastfeeding that I said in earlier, that that breastfeeding is regularly by the mother, which is very important in in any condition. Whenever the typhoid is also occur to your infant, then the continuous or the regular breastfeeding is necessary. After that we are giving fluids only. उसको क्या करना है, तरल पदार्थ देने। तरल पदार्थ का मतलब होता है सिर्फ उसे लिक्विड फूड ही देना है। तो जैसे कि अगर उसको बहुत ज़्यादा डिहाइड्रेशन होता है, देन उसको हम क्या करेंगे, ORS देंगे। ORS क्या होता है, एक इलेक्ट्रॉल होता है जो कि हम बच्चे को देते हैं टू प्रोवाइड देम एनर्जी। ओके, आफ्टर दैट ओनली फॉर द एडवाइस ऑफ द इन्फेंट एज एंड द कंडीशन। व्हाट वाज द कंडीशन, व्हाट वाज द what the stage of the typhoid, whether it is severe or it is normal, then whenever the doctor recommended, then you are giving the ORS or the fluid food for the infant, because your infant, which is very small, your baby is very small, which is not taking the medicines, not taking all the medicines, not get reacted over that. So whenever sometimes some overdoses are also given to the baby, that may cause death also. Okay, so please first of all go to your pediatrician and contact them, and then ask for the further treatment. नेक्स्ट पॉसिबल साइन ऑफ द टाइफॉइड इन एन इन्फेंट। कैसे पता चलेगा कि आपके बच्चे को टाइफॉइड है? तो दैट मीन्स कि आपको कौन कौन से संकेतों से पता चलेगा कि आपके बच्चे को टाइफॉइड है। तो उसके लिए परसिस्टेंट फीवर, यानी उसे बहुत ज़्यादा तेज फीवर होगा। पुअर फीडिंग और रिफ्यूजिंग फीडिंग, यानी कि वो बहुत कम दूध पिएगा या फिर बिल्कुल ही दूध पीना बंद कर देगा। अनयूजुअल स्लीपलेस और वीकनेस, उसकी बॉडी में क्या होगा, स्लीपनेस आ जाएगी, मतलब कि वो बिल्कुल वो कम समय के लिए सोएगा या फिर उसके अंदर बिल्कुल कमजोरी आ जाएगी। वॉमिटिंग, यानी कि उसे उल्टी हो सकती है। डायरिया एंड समटाइम कॉन्स्टिपेशन, यानी उसको पेट से संबंधित समस्याएं भी हो सकती हैं। इरिटेबिलिटी, बच्चे के अंदर चिड़चिड़ापन भी आ सकता है। एब्डोमिनल डिस्कम्फर्ट और स्वेलिंग, या फिर उसकी जो एब्डोमिनल, यानी कि जो उसका हमारा जो नीचे का पोर्शन होता है, पेल्विक रीजन होता है, तो उस रीजन में उसको स्वेलिंग हो सकती है या फिर उसे कुछ डिस्कम्फर्ट फील हो सकता है। आफ्टर दैट साइन ऑफ डिहाइड्रेशन, व्हाई वी आर गोइंग टू गिव द इन्फेंट about giving infant the fluid food, we are giving the fluid food because when this is a sign of dehydration also, and fever, wet diapers, dry mouth, and no tears when crying, and these are the signs of the dehydration. Whenever a child is crying but there is no tears, then this means it is a sign of the dehydration. We have to drink more and more water to get hydrated. Okay, next to that, what are the vaccine that is given to your baby? So TCV is a vaccine for the typhoid, that is typhoid conjugated vaccine, and 3 month, this is given on the 3 month, that the TCV is generally not routine, given this earlier. Whenever your vaccination chart is given of the infant, then this and that injection is included in that. But whenever your injection is not given to your infant or your baby in that period of time, that from 3 months to 1 year or the 2 years, then this injection must be, then that injection is must be generally taken within the period of the time, and we are not going to wait for till the adulthood. Okay, we are not waiting for the adulthood, and we are not going to express and we are not going to take the typhoid injection without the help, without the doctor's prescription. Okay, the doctor's prescription is very important. Okay, whenever your child or whenever your infant, whenever you also go for to the doctor, then you must be get treated yourself by the prescribed manner of the doctor. Okay, thank you.